It is well known that heart diseases are one of the biggest killers in the world. This is probably due to what is commonly referred to as unhealthy lifestyles, which include factors like obesity, smoking, dietary fat, stress, and many others. Most of these, if not all, contribute to the bleak scenario seen today. Heart diseases everywhere. Some of the major risk factors for cardiovascular disease are excess body weight, diabetes, and smoking. People who are diabetic without a history of myocardial infarction have equivalent risk of MI compared to non-diabetic patients with previous MI. Hence, all diabetic patients should be treated aggressively for the prevention of cardiovascular diseases. Over the last few decades, most of these diseases and disorders have been studied in depth and have been linked to abnormal blood lipid levels. One treatment approach that has gained widespread acceptance is the use of statins as lipid-lowering agents. Among the statin group of drugs, atorvastatin is one of the most widely studied and used. The clinical benefit of lipid lowering with statins have been well established in patients with elevated cholesterol levels. Numerous trials have documented the benefits of atorvastatin in the management of cardiovascular diseases and associated conditions. CARE, a secondary prevention trial, showed the benefit of treating patients with cholesterol levels within normal limits. In the MIRACLE trial, hypocholesterolemic therapy was useful in the setting of an acute coronary syndrome, while the AVERT study showed that aggressive statin therapy is as good as angioplasty in reducing ischemic events in patients with stable angina. The comparative statin trials, PROVE IT, REVERSAL, Phase Z of the A to Z, Alliance and TNT all show that high-dose statins will better reduce cardiovascular events in the high-risk patient. Investigators believe that the ASCOT LLA results support the global assessment approach to the treatment of cardiovascular disease rather than on numerical values of individual risk factors, and that benefits of lipid lowering with atorvastatin can be seen across the whole range of serum cholesterol concentrations. These trials provided strong evidence for the use of atorvastatin in patients with diabetes, acute coronary syndrome, coronary artery disease, and in patients with other cardiovascular risk factors like stress, obesity, and smoking. The clinical benefit of atorvastatin in these patients is probably explained by both lipid-dependent and lipid-independent effects, which include reduction in blood lipids, improvement of the endothelial dysfunction, and modification of the pro-inflammatory profile. It can thus be surmised that atorvastatin can be used in patients from different walks of life. Low-dose therapy with atorvastatin 5 or 10 milligrams can be used in primary prevention and risk reduction of cardiovascular risk factors like diabetes, stress, obesity, smoking, albuminuria,